All right. Well, it is a pleasure. I'm glad to see everyone here. I'm Bill Sisson with the Mobile Area Chamber of Commerce, and appreciate our panel of experts from USA Health. I think that we're all beginning to see a little bit of light at the end of the tunnel as we've seen the numbers trending downward here locally. But of course, we're still in the middle of a worldwide pandemic. But vaccinations, the more that those are administered, I think the better people are feeling about the economy and so forth. And as businesses, we really do want to explore the importance of COVID-19 and the vaccinations for companies in our area, and in particular, our small businesses. I think most people know that as a chamber, we have almost 2,000 members and 92% of those are small businesses. And it's really going to be key to keeping this economy going for as many people to be vaccinated as possible. So our panel of experts are going to help us to understand some specifics about the vaccine and the vaccination process. Dr. John Marymont, he serves on our chamber's board of directors. John, we appreciate that service. And he is Vice President of Medical Affairs and Dean of the College of Medicine at the University of South Alabama. John, I'm going to quickly turn it over to you and let you, open this up and introduce your team that you have with you today. So thank you, John.
Thank you, Bill. And it's a pleasure to talk about this. And we're going to talk today about the importance of COVID-19 for your business, but also with small businesses, how do you get your employees and the mechanism they have to get on the list and to get vaccinated? As Bill said, I'm John Marymont. I'm the Vice President for Medical Affairs for the University of South Alabama and the Dean of the College of Medicine. I'll let Mike, Natalie, and Owen introduce themselves. Go ahead, Michael.
Hi, I'm Michael Chang. I'm the Chief Medical Officer for the healthcare system at USA Health.
And I'm Natalie Fox. I'm Assistant Administrator and Chief Nursing Officer for USA Health's Physician Group. And I have also been deemed the lucky one that's been working on our vaccine response kind of since day one.
And I'm Owen Bailey. I'm the CEO of USA Health and also Senior Associate VP for Medical Affairs.
Thank you all. As you know, small businesses, as Bill said, creates jobs. And small business truly are the backbone of our economy. They're the cornerstone for our communities. And small businesses is where the jobs are generated. Next slide. And if you look at small businesses in COVID-19, more than 70% of small businesses across the United States were negatively affected by the pandemic. Almost 25% of respondents said they have postponed planned spending. About 16% actually decreased expenditures, and about 13% canceled some spending. So this has a huge financial damage to our economy, to our businesses, and to our people who are unemployed and small businesses that have been shuttered. But vaccinations have come out, and vaccinations really do help. And they could have a massive impact on controlling the pandemic, but also for small businesses, restoring confidence and increasing economic activity. I can tell you I have some remodeling going on. I have numerous small businesses here in and out of my house. I talk to them. They'd like their employees vaccinated. Therefore, their employees can say they're vaccinated, come into houses feeling secure, and people, the customers, also feel secure. And if you look at the U.S. Chamber of Commerce, really looks at accelerating vaccinations, and we need to reopen and reopen safely. And this is a virus that will be around for a while, and we got to get the pandemic under control. And this is really critical, and business communities will play a critical role in combating the pandemic. With that, I'll turn it over to Michael.
So I'm just going to spend a couple of minutes talking about the vaccines that are available to our community and a little bit about how they work, mostly to alleviate some fear and also to give you some ideas as to what the mechanism of action for these vaccines are. So there are really 3 vaccines that are available to us as a community. I think we've heard about all these in the news. There's the Pfizer BioNTech vaccine, the Mrna vaccine, and now the Johnson & Johnson vaccine. All have been approved by the FDA for emergency use. The Johnson & Johnson vaccine is the most recent one, which was at the end of February. We'll talk a little bit about the type of vaccine in just a minute, but really like to spend just a minute looking at how you go about getting these vaccines. The Pfizer vaccine and the Mrna vaccine are 2 doses. The Pfizer vaccine is 3 weeks apart from the first dose to the second dose. The Mrna vaccine, 28 days from the first dose to the second dose. The Johnson & Johnson vaccine is 1 dose. Why do we have to have 2 doses of vaccine? Well, the first dose of vaccine will give you a good short-term immunity with the Pfizer and the Mrna vaccines, but to really have the immunity last a long time, months to years, you're going to need a booster dose because the booster dose triggers a different type of immune response than the first dose does. The Johnson & Johnson vaccine is different in that it is a single dose. It's a different type of vaccine, so that allows it to be done through just 1 dose instead of 2. The age range on these is generally similar, 16 to 18 years of age. Pfizer has been tested and proven to be safe and effective as young as 16 years of age, all the way up through the continuum of life. Moderna and Johnson & Johnson, the initial tests were done in 18 years and older. Ongoing studies are looking at younger populations for all 3 of these doses. All these vaccines prevent death. That's and a very important message. They also do a fantastic job, 90+% at preventing what we call severe disease, which is disease that requires supplemental treatment like oxygen and or needing to go in the hospital. Now, let me go back again and say that, and this has gotten a lot of publicity on the front end. The Pfizer and the Moderna vaccines are what we call mRNA vaccines. It's before this. Before this pandemic was thought to be a relatively new vaccine modality. And yes, it is true that before Pfizer and Moderna's vaccines came up, that none had been approved by the FDA. That doesn't mean they're brand new, though. They've been working on these techniques for up to 20 years, and they're working beautifully. So how do the vaccines work? The Pfizer and the Moderna vaccines both are what we call messenger RNA or mRNA vaccines. So what you get with the vaccine is a piece of what we call mRNA, messenger ribonucleic acid, encapsulated in a lipid that is injected into the muscle. The mRNA encapsulated in the lipid becomes incorporated into the cells, and the cells use that mRNA to make a portion of the virus called the spike protein. It's what you see in the pictures. Looks like a little broccoli flower coming off with the virus, and that portion of the virus alone cannot make you infected, so it's perfectly safe. And again, you give this vaccine as an initial dose and then a booster dose. The Johnson & Johnson vaccine is a little bit different. It's what we call an attenuated adenovirus vaccine. What that means is that the labs have taken an innocuous, harmless version of an other virus and put an agent called DNA, deoxyribonucleic acid, into the virus, and that's given. Lots of vaccines that we receive already routinely in our lives are this type of vaccine. That DNA is incorporated into the machinery of your cells to make that same spike protein, and then your body generates an immune response to that spike protein, and that's how you become immune to it. It decreases, again, hospitalization, the incidence of severe disease. It's safe, and it's long-lasting. So with that, I'll turn it over then to the next speaker.
I'll pick it up here, Mike.
Bill just asked us to go.
We'll talk a little bit about USA Health and our response to the entire COVID pandemic. First thing I'll say is I'm just so proud of our team and how they've how they've handled this past year. Certainly one of the most challenging years anybody can ever remember. And they've just worked very hard and dealt with some very stressful situations, and just continue to show incredible compassion and resiliency and teamwork. So I'm very proud of our team. Going back a year, if you back up one more to the picture, I want to just quick comment. If you back up a year on the testing side, not the vaccination side, we began a partnership with the city of Mobile, which I really can't say enough good about that partnership and how important the city's relationship and support's been. We started on Catherine Street with a very small clinic, primarily for our own employees. That grew over the Ladd Stadium. And then we moved over to the Civic Center, and now the testing component of this, and we've been averaging about 200 a day for a long time, is in the Expo Hall, right adjacent to the picture on your screen, which is the Civic Center arena. And that's where the testing process is happening. What you're seeing there is a picture of the Civic Center and our vaccination effort, which started back in January. And I think folks generally enjoy driving into the Civic Center. Certainly getting a vaccination is a different dynamic than getting a test. And there's a lot of hope and joy that happened in this arena. And we've learned a lot. We like the drive-through aspect of this for a lot of reasons, including just the being able to contain the not having to get out of the car and move around, and on the 15-minute or 30-minute observation, that makes things a lot simpler as well. So let's go ahead to the next slide. There again, it's just a recognition of the partnership with the city of Mobile and how much they do to support this effort, and how important that relationship has been. We're vaccinating more than 1,000 people each day. That number's been steadily increasing since we started in January. Okay. We have been we've done a lot of vaccination events, and these are some of the larger employers. I won't read that list, but just have it up there for you to see. And that list is growing, and we have been our team. I can't say enough about Natalie and her team, and Doug and his team, how well they've worked with any group that wants to work on getting vaccinations. It's just so important to get these vaccines out there. A lot of these companies treated this as a big event. In coming to the Civic Center, they would send employees holding up signs, having drawings for prizes. And it's been fun to see how the different employers approached getting the vaccinations for their employees. Okay. This next page talks about we've left the Civic Center plenty, and doing more of that as we try to reach especially into some underserved areas, minority neighborhoods, and we have, again, I'll leave this list up here. Some of the ones on this list we've been working with to bring folks into the Civic Center, and on many on this list, we're actually having clinics at the site in the community. And then we always go back 3 weeks later, we do the Pfizer vaccine to give the second shot. This has been a very encouraging effort, and we've seen a lot of good come out of this community outreach. This final slide I have just shows you some numbers, kind of where we stand. The top number on the left, 59,000, that's how many tests we've done in this past year to date. And we've done right around 57,000 vaccinations since we started that effort. We're about at 53% of our own employees. That does not include employees who may have gone elsewhere to get their vaccine outside of our system, nor does it include the employees who've actually had COVID. So that number is larger. And then about 44% of the overall university family, and that number is growing as well. All right, Natalie, I'll turn it over to you.
Yeah, so I'm going to jump in now, and I'm going to talk a little bit about how we want to collaborate with you to increase vaccination rates in your community. So the first thing that you can do as an employer is to provide access for vaccines. So you can point your employees to resources. Vaccinefinder.org is a national website that vaccine providers register with. So you could go to Vaccine Finder, put in your zip code for the location that you're looking for, and you can actually see different CVS's, Walgreens. You can see what type of vaccine they're giving out of the 3 that Dr. Chang kind of talked about, and then what was their availability look like. USA Health is also here, and we can collaborate and coordinate directly with you on some of these efforts. Just like you saw Owen mention on the slide before, several of the businesses that we had been working with were some of the larger businesses, and we really want to work with small businesses as well. So one easy thing that you can do is you can share our vaccine registration website, which is usahealthvaccines.com. At that point, your employee, if they choose to go on there, if you send that out via email or text message, they can just put in their name, their birthday, and through their cell phone, they can connect directly to self-schedule them an appointment to come to the Civic Center to get a vaccine. We've had a lot of companies take that approach. Alternatively, we've also worked, Doug and I together have worked with several companies where they would send us a list of their employees. So they kind of did the compiling of the people that they knew wanted a vaccine. And then I had staff actually reach out to them and call them and say, you know, when do you want to come? And we would have a, you know, one of those person-to-person direct contact with them to set up their appointment. The other thing that we have actually seen happen is that, you know, we have allocated space so that there was no appointment or anything needed, but it helped us because I knew your employees were coming. And so we've decided to do that on April 16th on Friday. So next Friday, we have allocated space in our schedule just for small businesses. We wanted y'all to be able to have a day where you can say, you know, you can show up to the Civic Center on April 16th. They are going to be able to get you in. We will stay. We will vaccinate everybody that day that shows up between 8 a.m. and 5 p.m. And that way, you know, to make it as easy as possible, that's all they have to do is just show up. We can do some of the things that Owen said. We could get some great signage out there to just show our appreciation for small business as they come through, as well as our excitement for vaccine. Doug, I'll ask if you want to say any words about kind of how you spend as a liaison, sometimes connecting with the different companies and to me, and how most of the time we see companies take an approach to all three of these to kind of increase vaccination rates.
Absolutely. And again, I can't thank Natalie enough and her team for the support. And every time I've ever asked Natalie, can we do, or is this possible? Her answer has always been yes. So just the support that she's given to me and the companies that we've reached out to has made this such an easy process with the different options of communicating with the employees, of the easiest way to communicate, either through the website, cell phone, or emails. I see quite a few people in this Zoom meeting that might not be aware of the changes in my position, but I am now with USA. So my cell phone number is the same, but if you want to reach out to me, I can help with the coordination process as well. So anything we can do to help with education or scheduling, please feel free to reach out to me and let me know.
Thank you, Doug. And yes, Doug's been great to work with. We're super excited to have him on our team. So the next thing that you can do for your employees is to try to build confidence in vaccines through communication. So communicating transparently with your employees, sharing key messages, and emphasizing the benefits of what vaccination can do for them. One way that USA Health can happily participate and collaborate with you is that we are happy to provide you with informational materials and resources that you can share with your employees. We already have a lot of those developed, and you can reach out to me directly, and I'm happy to share any type of, you know, question and answer document that you wish to distribute, anything related to how the vaccine works, what they can expect after vaccine, anything like that that we can do to help you communicate with your employees, we're happy to do. Also, we're happy to do a short informational session. We have a lot of people from USA Health on here right now, but we have a lot of other experts in the field that can connect directly with you and any employees that you have to kind of increase confidence in vaccines through communication and delivering the facts. So again, we're happy to do that as well. Another way to build confidence is through developing vaccine champions. So really encourage your leaders to be those vaccine champions. And you know, your leaders should really reflect the diversity in your workforce. And you want those leaders to connect directly with the people that they work with and give them a peer-to-peer message on why it was important for them to be vaccinated. And more importantly, share why they got vaccinated. So one of the most, the strongest things that we have seen happen in our own workforce is it's not necessarily when I deliver a message or Owen delivers the message, it's when the person that they work directly with day in and day out shares with them why they got vaccinated. And you might have employees that are willing to do this, but maybe they don't quite know how. And again, that's where USA Health can come in, and we would be happy to collaborate with some of your vaccine champions, try to make sure that they have some talking points whenever they're talking about vaccine to some of their different coworkers, as well as what that peer-to-peer coaching really looks like. And again, that is proven to be probably one of the most significant ways to have an impact on vaccine uptake. I know a lot of our physicians here will have shared a lot of personal stories of the interactions that they've had with different employees, you know, in the one-on-one setting. Sometimes it's not as much about those informational sessions that I told you we'd be willing to do as it is in some of those one-on-one conversations that you have directly with somebody that you see every day about vaccines. And one final way is to build confidence is just through celebration. So just make it visible. A lot of employer groups had provide, you know, stickers, or at Mobile County Public School System were giving their employees masks after they got vaccines. We had some great Mardi Gras beads for a while during Mardi Gras season that everybody loved. They were a hit on social media. We're seeing a whole lot of selfies on social media, really actually celebrating their decision to get vaccinated. And again, there's so many different ways that you as a company can celebrate those small wins among your employees that also choose to get vaccinated. So now just briefly, I'm going to go through just about 8 slides that I have about some misconceptions and misunderstandings of vaccines, but then we want to turn it over to y'all as the audience and give you a chance to ask us questions. We are here to answer them. So I'm going to talk just briefly through a couple of topics, some of which have been in the news a lot, and then some things that I probably didn't think of. But any questions that y'all have, you can use the chat function if you don't want to talk, and you can actually type your question and I'll read it out. Or of course, you can just turn your mic on and ask us directly, and we're going to do our best to answer it. So again, we just want this to be interactive. So just really quickly is about vaccine safety. That's one of the things that we know we've heard a lot about vaccine hesitance is it safe? So at this point, and I looked up this one again today, over 63 million people in the US have been fully vaccinated against COVID-19. And not only have they been fully vaccinated, but they've been safely fully vaccinated, meaning there's not been anybody that has died from a vaccine, right? There's not been any type of reported long-term sequela that, like Dr. Chang talked about, disease, like ending up in the hospital. We haven't had any of that. This vaccine has been studied probably more so through some of the data that I'm about to talk about than any other vaccine we've ever had, because they use this tool called VSafe. So if any of you have received a vaccine before, we or any vaccine provider should have given you information on the CDC tool called VSafe that had, you know, millions and millions of users across the US, where the CDC was texting and collecting data in real time from people who received a vaccine. And we learned some key things about it. And one of those was about those anaphylactic reactions. So one reason that we have to keep somebody for 15 minutes at the site is to make sure that they're not going to have a reaction. But what VSafe taught us was that it's about a statistic of 11 in a million that actually will have some type of anaphylactic reaction. And so far to date, because we're doing that 15 monitoring, all of, you know, of those people, they've not had any type of adverse event that resulted in death. They all were able to have access to medical care within that 15 minutes and have that anaphylactic reaction addressed through something simply like epinephrine. So again, the vaccine safety is one thing that we feel like there's a lot of misconceptions and misunderstanding about. Another one would be pregnancy and lactation. So there's been a lot in the news about if you're pregnant or you're thinking about having kids, or even if you're breastfeeding, is this vaccine safe for you? And the answer is overwhelmingly yes. So our societies that we look to in medicine to kind of create standards of care and go off evidence-based practice have came out and said, you know, the ACOG said, you know, this vaccine is safe for pregnant women and they should indeed take it. Chronic illness and immunocompromise. So one question that I get day in and day out at the vaccine site is from patients who've shown up, but they're still hesitant. They've went the extra mile. They've actually came to get their vaccine, but now they're telling me, you know, I don't think I can take it because I have diabetes, or I have hypertension, or I take a certain medication, or I'm immunocompromised, I'm being treated for cancer. But in fact, those very people are the ones who are most highest risk for COVID-19 complications and should indeed get a vaccine. The variants. I think that you can't look at the news today without hearing something about the COVID-19 variants. And just a quote here from Dr. Fauci, which is, you know, the challenge that we currently face right now is that trying to vaccinate enough people to stay ahead of the variants. So kind of like time is of the essence for us. And that is one thing that we definitely know. What does it mean to be fully vaccinated? You know, and the CDC is constantly coming out with information that's changing. And at this point, there's a couple good things that you could share with your employees. One is that if you're exposed to somebody who's positive, you don't have to quarantine. So that's very important for your workforce because that means you don't have to have unnecessary days out of work if they're vaccinated. But it's also really important for your family life because now you can actually go and be around family unmasked indoors. And I think that that's something that most people wanted the most, is to really be able to reconnect with their family. There's also travel benefits, and these again are changing every day, to which the CDC came out and said, you know, if you travel anywhere right now in the US, you don't need to be tested if you're vaccinated. If you're traveling internationally, again, you don't have to quarantine when you return. And so again, you decrease those days that that you potentially have loss of work. You know, it's something that's super controversial as vaccine as a work requirement. And you know, why it's legal, it's probably not likely going to happen right now, but there is certain rules through the EEOC that already allow mandatory vaccines, like such as flu vaccine in certain industries like healthcare. And I did do just a little bit of research to see, you know, what is really happening on the forefront. Our industry is really going to be requiring their employees to get vaccines. And of course, we see that the most in healthcare and food industries. They kind of had the highest percentage of thinking that they were going to require a vaccine. And the main thing that I wanted y'all to know is that it's legal, but I don't know if we're going to see it across the board in every type of different industry. Just another quote about how complicated it is to try to enforce vaccine work requirements. Vaccine incentives. So this is definitely something I thought that y'all might want to talk about today and just kind of draw some discussion around, is what kind of incentives are we seeing? So the EEOC did issue some type of proposed rule back in January where they were going to talk about doing just a small incentive only. Nothing ever actually finally went through with that role. That kind of got put on hold through the change of administration. But basically they wanted to limit the amount of money that you could give as an incentive to get your employees to get vaccinated. What we're kind of seeing the most within companies is that they're providing the time for their employees to go get vaccinated, such as, you know, they're allowing them the 2 hours. They're not having to use their own time off to go actually get vaccinated. They're actually compensating for that time or paying them for that time that they actually went and got vaccinated. We've also seen things such as gift cards, not individual gift cards to everybody who's gotten a vaccine. What we've seen are things like, you know, they've set goals for themselves, like we want to reach 500 vaccines. And once those 500 people get vaccinated, we're going to do a gift card drawing for $500. And one of those who got vaccinated will be eligible for that gift card. And last but not least, thinking about topics that are kind of hot and crazy out there right now are the vaccine passports. So I did see that the American Steamboat Company recently announced that they are require all crew and guests to be vaccinated started this summer. And, you know, I think that every day you read the news, you're going to read of somebody else, but the challenge is, how do you really do that? So I have a picture of one of those lovely cards on there. Those cards, while great and serve a good purpose to show you got vaccinated, they're not super easily. I could take a card just like this picture that I just snapped right off of Google, and I could get my hands on something like that and write down that same information. So again, the counterfeit cards, when you're hearing about vaccine passports, what they're really talking about is a way to actually validate that this person has been vaccinated. Now, whether or not we start, you know, showing some type of proof to travel or to get in certain venues, you know, all that's yet to be known. But again, every day, new information is coming out about what's happening around not just the US, but around the rest of the country related to vaccine passports.
Natalie, excuse me 1 second. Let me just remind everyone to please put their computers on mute, their Zoom on mute, and unless they have a question, just so we can eliminate some of the background noise. So I'm sorry about that. Thank you.
Yeah, no problem, no problem. And actually that leads me to, you know, open it up for questions. So at this point, we've kind of covered everything that I thought were kind of some hot topics that I wanted to kind of bring up with people to think about their questions. But we're here to answer any other questions you may have. So feel free to ask a question directly, or of course, like I said, you can post it in the chat and we can find it there too. And I'll read those out for us. So any questions from anybody related to vaccines?
I'm going to take the liberty of kicking off with a question.
75. You came to my house a couple times in the last couple of months on Old Government Street in Midtown.
I'm not sure that was that a question? Sorry. Again, I'll just remind everyone to please put their mute on if they're not asking a question. But let me ask this question if I could. You mentioned the incentives that were in place in some instances at companies. I was curious, and we're doing that as well. We're allowing no penalty to PTO, paid time off, if someone is going to get the vaccine. However, sometimes people do get side effects, and in some cases they may not be able to come to work the next day. So my question is, and probably for Dr. Chang, what percentage of people are having those kind of side effects after the second dose of either the Moderna, Pfizer, or Johnson & Johnson?
So the reported the reported incidence of side effects such as headache, significant arm pain, fatigue, drowsiness, and those sorts of things is somewhere in the range of 15% or so. And a couple of things to say about that. Number one is those side effects, from our experience here at USA Health, have not actually been significant enough to keep people out of work. The second one is that the side effects actually mean that you're mounting a good immune response, right? So if you have those side effects, that means that your body is reacting appropriately to the vaccine itself. But it's about 15%.
Thank you. Natalie, looks like we have a question on the chat.
Sure, you can go ahead and read it, Bill.
I'll read that. What's your position on those who had COVID needing only one vaccine or no vaccine?
I'll take that one if you don't mind, Natalie.
Absolutely.
So there's two things that I have heard that two reasons people are saying I'm not going to get the vaccine, amongst several. One is that I already had COVID, or I'm pretty sure I had COVID, and therefore I'm immune and I don't need it. And then the other one is more along the lines of, well, I've made it this far without COVID, without getting COVID, and therefore I'm just going to wait. Because if I made it this far and the incidence is low, I'm not going to get the vaccine. Let me address each of those. First of all, the one that came up on the question. If you've had a documented case of COVID-19 infection, we don't know how long your natural, or what we call innate immunity, is going to protect you, nor do we know how well it's going to protect you. So we have an idea that you should be reasonably well protected for about up to 3 months, but beyond that point, we don't know that at all. In fact, we've seen a significant number of people get reinfected at or about the 90-day window. And so that's a much shorter period of immunity and a much less predictable period of immunity than it would be were you to have any one of the 3 vaccines that are available. Okay, so even if you've had the COVID-19 infection, we recommend that you proceed forward and follow the guidelines and get the vaccine at the appropriate time, or at least outside of the minimum window. And Natalie can speak to what that window is. The second one that I like to address is the way some people are feeling, which is either I'm young and I haven't had the infection so far, therefore I think I'm going to be okay because the 7-day moving average is going down across the country and so on. Couple things. Number one, the vaccine is mutating rapidly, and there are almost more variants than we can count now. The common ones are what we call the UK variant, the Brazil variant, the South Africa variant, and so on. But there are other variants that are out there. With this disease as prevalent as it is, the vaccine is going to mutate. And the longer you wait until you get vaccinated, the greater the chance that you would get infected with a strain of the virus that the vaccine may not protect you optimally for. Therefore, it's not a good idea to just take your chances. Secondly, if a significant number of the population waits and things pick back up again. For example, I've got a friend in Toronto, a surgeon in Toronto, that sent me a picture yesterday, where the parking lot of the largest hospital in Toronto has been turned into a mobile hospital because they're undergoing a major surge up in Toronto, Canada right now. If you wait and your body is naive to that infection, then it could be worse next time around, and the next wave could be even worse. So we're encouraging everybody to move forward with the vaccine, with getting vaccinated.
Let me add something to what Dr. Chang's saying. You've been infected with COVID. As Dr. Chang said, you don't know how long your window of immunity is. And what you have now is a vaccine. The Pfizer vaccine, the Mrna vaccine, J&J vaccine, that has been shown effective 100% against death and really keeping you out of the hospital, meaning your illness isn't that severe. Just because you had COVID once and might have had a sniffles or asymptomatic doesn't mean the same thing's going to happen if you get reinfected. And what's coming out also is some of these vaccines have been shown to be effective against some of the variants, such as the South African variant and the UK variant. So I have two boys, 26 and 28, one in New York City and one in New Orleans. Both have been infected, but they are going to get vaccinated because you just don't know what their immunity is.
Absolutely. And you know, and I think that they've covered that topic quite well. And I would say that another question that we typically get about somebody who's had COVID is, when should they get the vaccine? So that's kind of something Dr. Chang hit on. And, you know, as the CDC says, as long as you're outside of your isolation window, which is 10 days after symptom onset and your symptoms have been resolved at least 24 hours, you can get the vaccine. Now, there's a lot about this 90 days, like waiting 90 days after you've had the infection. And the reason for that is it wasn't what the CDC said we had to do. It was just in the presence of vaccine shortage, right? That the idea would be that the people who had just had COVID might have had a 90-day window where they weren't going to get reinfected, and we could offer those vaccines to other people. After talking with our infectious disease experts, like for immediately, you know, at the very beginning, we went ahead and we realized that we had enough vaccines to cover all of our employees. We did not say you had to wait 90 days. And that's the same thing we say now. Right now, I have vaccines available. There's no reason that anybody needs to wait 90 days. I will say another part that we try to do is to try to give everybody what to expect after vaccine, and specifically after somebody's had COVID before. You know, what has been known is that second shot is what you're referring to, Bill, where you might actually get the more fever, headache, tired, fatigue, and that usually doesn't occur to the second vaccine for most people, except for if you've had COVID before. So people who have had COVID before have kind of already went through that booster primer that Dr. Chang described. And so we just want to go ahead and tell them to expect, hey, you might actually have these type of side effects with your first dose. And that way they're not worried, they're not scared. We just want them to know to expect it. And then people can usually handle those side effects because, again, they're going to be self-limited even if they have them. It just means that their body recognized that right away, which is a good thing, and is mounting that immune response.
What other questions do we have from participants?
So we've got one here. Is there any idea on whether those who have been inoculated will need a second round of inoculations a year or two or further in the future? We don't know right now. It's likely that, especially if variants develop are identified that are somewhat resistant to the vaccines that we have now, that we'll need another dose of a modified vaccine to protect us optimally. It also could be that the immunity that we develop with the initial 2 rounds of the vaccines of the Pfizer or the Moderna or the single dose of Johnson & Johnson will need a booster at some point down the line, but we just don't know what that is yet. I would be thinking that the likelihood of needing a booster is very high. The timing of it is unknown.
Absolutely.
Other questions? I have one for Owen. Owen, I think you were the one that we're talking about the major companies that you'd worked with. And I was just curious, do you know what the general percentage is of those employees that have been vaccinated at those larger companies? Or is it across the gamut?
Well, Natalie, you probably got a better handle on that, or Natalie or Doug.
Yeah, I can talk, and I think it's varied, but I think that what we've seen universally across industry is that the first 30% of your employee base, no matter what industry you're in, seems to come pretty quick and pretty easy. I see that most companies that we have worked with have had to work pretty hard to get to that 30 to 50% range. And, you know, to get over that 50% range, that's what we're kind of seeing even harder having to work at, to really try to do some of those tasks I talked about before, as far as building vaccine confidence, using those tools like communication champions and celebrations. But I would say that most of the larger companies still that have shared those type of that information with me, for me knowing, you know, how many employees they have and what they're telling me, it's been anywhere from 30 to 50%.
Thank you. Other questions?
Bill, I have one. I was going to ask, the second dose, you should get it from, I assume, the same person you got the first dose from. I know it has to be the exact same type of vaccine, but you have to get it from the exact same person, exact same group.
I'll take that one because we get that question a lot at the site. So you kind of hit the most important part right on the head, which is that you have to get the same product. Meaning if you got a Pfizer product, you really should get a Pfizer product for your booster. If you got a Moderna, get a Moderna. There is a lot of encouragement to go back to the same provider who gave you your first one to get your second one. And really that just has to do with the way the vaccines are distributed, and that if you go get a vaccine from somebody who didn't give you your first one, they're not necessarily going to have that in their stock, because what they are receiving are first doses and they're receiving the second doses to go along with them. So they could end up kind of short along the way. So I have seen that message. Now, that being said, we have people, think about the institution we work with this USA. We've had, people who live somewhere else when they were in the winter that have moved here now, and it would be unethical for us to withhold that second dose of Pfizer. As long as they can tell us that they've had a Pfizer vaccine, we're willing to give those as a booster. But we really have had those as rare circumstances, and they've been people who've moved around. What I haven't seen now is a lot of stuff like in town where people are trying to go to different places, like meaning that you got your first dose Pfizer at Walmart in town, and now you're trying to get your second dose at CVS. That's where it gets a little bit more complicated.
We've kind of moved from the first phase of this, where it was a supply issue when we didn't have enough supply for the great demand, and now supply is not so much an issue. It's just a matter of getting the willingness to have the vaccine.
And just to kind of give everybody an idea, kind of what Owen's talking about and how I can't describe the changing landscape of this enough, and how many times we went back and forth. But last week on Monday, we had 1,500 first shots that we gave. And, our staff was they didn't even get to take any break. They probably started before 8. And I hope that they got out of there by 8 p.m. It was definitely a long day. We had to adopt a lot of our processes. But, this week, our highest day that we've gotten has been 700 vaccines this week. And so I think that what we're going to see now, that could be multifactorial, right? Like it could be because it's spring break and people are traveling. It could also be that, the demand is kind of trickling down, because a lot of now we expected to be really busy this week, because this is the first week that the governor basically said anybody 16 and older, which is what we've been looking for, because it was kind of complicated to navigate some of those other, based on employer groups, age, or chronic condition. And so I think we'll see in the coming weeks what the demand will be. But as Owen said, I think what we're experiencing here in Mobile is the same thing that's being experienced across the nation related to demand.
And I think to the companies that are on here, I would say, if you have ideas about how to promote this or work with us, we're more than willing to talk with you about that. We've approached this for several different ways. The Civic Center operation in particular, which is extremely well run and efficient. Natalie's team treats this like a lean project. Every day they're trying to make improvements, and they're just doing an exceptional job. But we've also gone, as you've seen, to church parking lots and other locations like that. We even did 50 schools in Baldwin County in 3 days. And so we're open to creative ideas that you may have. It's all about getting this vaccination out there as much as possible.
I have to commend you guys. All the feedback that I hear is that people are so impressed with the streamlined process. I mean, it's right up there with Chick-fil-A, people say. So you've done a great job of getting folks in and out quickly. And also the USA Health vaccines.com registration process, very easy. That's really been a great service, and we appreciate that. We had another chat question, and that was, we've had employees that have lost their vaccination cards. Is there any way to get a replacement card?
Yeah, the old vaccine card comes up again. I tell you, it's my day to day. And yes, there is. So of course, you can go back to the vaccine provider that gave you the vaccine, and you can ask for another card. We at USA Health, we use our medical record, Athena, to log all these vaccines, and you can self-sign up for the Athena portal. And within that Athena portal, you can actually download the actual official medical record documentation that says what vaccine you got, the date, and the lot number. And of course, it will actually print off right from there. The other option is just to say that you got your doses somewhere else, is that all of us who are vaccine providers are required to log these doses in our state immunization record. It's called Imprint here in Alabama. And so again, even if for some reason where you got your vaccine isn't somewhere you can physically get back to in 2 or 3 years, this information is going to live in the imprint system. And most people who have kids are familiar with the imprint system because it's the same way we treat childhood vaccines and those blue cards in school entry. So again, there's a lot of different avenues to be able to show that you've had this vaccine. But of course, you can always come back to the provider that gave it to you to get you another one of those white cards like you see on the screen. And if it's USA Health, feel free to contact me and I can take care of that for you.
You know, when thinking about lessons we've learned as healthcare providers in COVID, you know, we were kind of some of the silver linings and sort of some new delivery models. Just thinking about telemedicine and how far that came in the last year, that would have taken us probably months and years. We had to adapt in a matter of weeks, and that's been important and I think a good thing. Also, the testing center, which is next door to the vaccination center downtown, is now also used for a whole pre-op component for some of your pre-op work or blood work that can be done out of the car. So this whole concept of kind of drive-through healthcare, I think is going to be here to stay in a lot of ways. And so I think that it's just been an interesting year in a lot of ways, of course. But there are some things like that I think are going to stay with us as we talk about the way healthcare is delivered.
Absolutely.
We had another question come in the chat. This is from our own Bob Chappelle, and I happen to know that this is probably a very personal question because he got the J&J. It said, what would you say to someone who had the Janssen vaccine and experienced no side effects?
I would say that's a good thing. I mean, number one, the majority of people that get vaccinated with any of the 3 vaccines that we have available are not going to have side effects. And the absence of side effects does not mean you don't have a response. The presence of side effects, though, is a pretty reliable indicator that you did have a response. But if you get the vaccine and you don't have a response, it's just fine. You're going to be immune.
As Dr. Chang said, go by the data. Just because you don't have a reaction, I get malaise when I get the flu vaccine. Like clockwork. I don't feel well for about 2 days. I didn't have a reaction to unfortunately, both doses of the Pfizer. So you just go by the data. It's working.
Okay, other questions? Well, we want to make this as easy as possible for our small businesses to access and find the time and get as much of their population vaccinated as possible. John, I know because you serve on our board and you've talked about this a lot. I mean, you have a soft spot for small businesses. Any thoughts there as it relates to what we can do as a chamber to really encourage, our businesses to take advantage and access the vaccines?
I would just spread the word. You have the opportunity to get a vaccine that's 100% effective against death, where in a year, 550,000 people have died in America. And the problem with the vaccine is you don't know how it's going to affect who. It does affect minorities, Latinos, Blacks, but I can't tell you on the screen, if we started a year ago, how each one of you would react when I can do that with other disease processes. And so you have a vaccine, you have the ability to diminish as a small business downtime for your employees, particularly small businesses. You lose 2 or 3 employees, it can be a big deal and wreak havoc, on your ability to stay afloat. So you have the opportunity to get a vaccine that will keep you out of the hospital and will keep you from dying in the current COVID, and the ability to hopefully manage your employees and manage your business and stay afloat. And it is easy to get. The side effects are minimal, and we're here at USA Health to help you. So you can reach out. I know I go to small businesses. I got my haircut at Nouveau yesterday down on Dolphin and Florida, and I gave them the brochure and they were thrilled. They're just talking about the vaccine. So every restaurant I go to, I try to get out to the small businesses. You should too, pass the word around, and it's something that will help Mobile and the entire region stay afloat.
Well, we have had quite a good number of participants today, and we will post this recording on our website. And we do find that we have hundreds of members that access the recordings later. That's one of the great things that's come out of this pandemic, is that we've realized that we can, provide better access to our programming virtually to a lot of our members because they can go back and look at the recording later. So we'll certainly push that out. We also want to make sure that everybody on this Zoom call is aware of the event coming up on Friday, April the 16th from 8 to 4, what Natalie mentioned. They're hosting a small business vaccine event, and we're certainly going to push that out. And I hope as many of our members as possible will take advantage of that. And we cannot thank you enough for providing that. I think that's just a great service. Dr. Marymont, Dr. Chang, Natalie, Owen, Doug, thank you for your tremendously helpful information. We've got a lot of thank yous in the chat box. It has been wonderful information. So one of the things that I'll close this by saying, one of the things I'll say in closing is that you mentioned maybe additional informational sessions, and I believe that would be something we would definitely want to take you up on. Perhaps some more intimate and more detailed presentations with some of our councils and committees. That might be something that we could work out through our small business committees. Daryl, we can talk about that later, but we would certainly like to take you up on that, because I think there are just going to be lots of different ways that we can get this information out, and we want to do that. Again, we can't thank the USA Health team enough for the invaluable time that you have given to us. We thank you for that. And I certainly hope that everyone has a great rest of the afternoon and the upcoming weekend. So thank you very much.